Lena Samuels, I chair South Central Ambulance Service, and the Hampshire and Isle of Wight, I am the designate chair for that. So for South Central Ambulance Service, of course, we are providers of urgent and emergency care, as well as patient transport services. During the current time, of course, COVID particularly has had an enormous impact on staff, enormous amounts of pressure, enormous amounts of demand. So this is something that staff are having to deal with currently. For Hampshire and the Isle of Wight Integrated Care Service system, we have an enormous number of staff who are transitioning from working within the CCG environment to working differently. So it's been a period of uncertainty for them, as well as needing to work at scale as part of a system with partners in a new and different way. So at South Central Ambulance Service, one of the things we did for staff was to set up a portal that people could go to for dedicated information. And we recognised that there were many pillars to support the well-being of our staff. So it was inclusive of mental health, emotional well-being, but also all of the other factors that have an impact on people's life, treating people as whole people, treating our staff in that way. And within that portal, there are a range of different resources that people can go and find either information or connection points to go and seek additional support. I think it was really important that that was available over recent times and for it to be easy for people to navigate. Within Hampshire and Isle of Wight ICS, we created an intranet and made it very user-friendly. We provided spaces for people to talk about their personal life and their experiences. And it was designed almost as if it were a Facebook page. So it was very easy for people to interact, but also more importantly, for people to connect with others across a very wide geography and feel like they were working together, particularly when people were having to work from home. I think some of the great achievements that we managed to put in place for South Central Ambulance Service was the sense of empowerment that staff had in terms of taking care of themselves, and we had staff stepping forward with some great ideas about what could be done. We had our community first responders going out with a teapot, basically, as they called it, which was a truck with refreshments for staff around our different sites. And we also had one of the team leaders working with the local community retailers to create and design a garden, an outdoor space for people to go to. And it just changes the way being at work feels for people and gives them the right environments to go and decompress. If I had a bit more of a budget, I know we very kindly have received some funding towards health and wellbeing recently, I would really be wanting to look at how we can apply innovation to looking at new and different ways that we can create immersive experiences for staff that enable them to truly step out of a place which is highly stressed and then reframe their thinking and their emotional well-being so that they can step back in. The thing with the ambulance services, it's a bit relentless, so finding new ways through the use of technology to achieve that, whether it's through soundscapes, for example, or using other forms of auditory experience that I am aware can have an impact. It would be good to be able to use the technology to do that.